Thank you so much, Bethany. I'm just going to quickly share my screen. There we go. And thank you so much for inviting me to talk, Shirley. And thank you to everyone who has come to listen to the lecture. I have to apologize. I'm losing my voice. I woke up with a cold today, but don't worry, I had a COVID test and I do not have COVID. So this has been somewhat shortened just a little bit because I'd rather leave more time for you to have question and answer time rather than me exhausting my voice on an extra long lecture. So I am Heather Munro. I am an anthropologist. So anthropologists study human culture and society in the present day as well as in the past. And I very much study what's going on today. I study Ultra-Orthodox Jews, and I did my PhD at Durham, and I'm now working at Oxford, as Bethany so helpfully said. Who are Ultra-Orthodox Jews? Just in case you don't know or aren't sure, they include Hasidic Jews, but they also include a couple of other different kinds of Jews and groups of people, as well as Hasidic Jews, who we see a picture of on the slide. There's also many Jews who are considered ultra-Orthodox, who are sometimes called Litvish or Yeshivish or Mitnagdim. They may look very similar to Hasidic Jews on the street. They dress very similarly, but they have very different theology. There are also Jews from North Africa, the Middle East, and other parts of the world that are part of the whole world of ultra-Orthodox Jews. And these Jews are attempting to maintain sort of a continuity with past strict historical observances of Judaism and trying to maintain traditions as well. So that's who I do research with. This project was in New York City this summer, and it is very much thanks to Johns Hopkins University Medical School for funding and Dr. Zachary Berger, who supervised. Over the 2.5 months that it took place, we managed to include 10 Hasidic men and women, which we feel very happy about. It's a really good amount of participants for a short ethnographic anthropological project. They were all Hasidic people. Nobody was Litvish. Some people were from the Middle East and other parts of the world and Hasidic. So there was some really interesting diversity there. The vast majority of the people I talked to were part of the Satmar Hasidic sect. There were also 2 people from Munkach, which is a similar Hasidic sect to Satmar. They're both Hungarian Hasidic groups, and they both have very strict interpretations of certain types of Jewish laws. I also spoke to one woman who was from the Babov sect, which is also a Hungarian Hasidic group, but they're a little bit different, and they're a little bit more like the rest of the mainstream Hasidic groups. And I spoke to a Lubavitch woman as well. And Lubavitch you might have heard of called Chabad, which has a presence all over the world. I conducted these research interviews and participant observation, watching people go about their daily lives and spending time with them in their homes and chatting with them in Brooklyn, in Williamsburg and Borough Park in Brooklyn, in Monsey, which is an enclave community in upstate New York, and in Kiryas Yol, which is a village in upstate New York that is entirely Satmar. Of my research participants, just to give you a picture of this, 60% of participants had confirmed cases of COVID. So this means they told me that they had had a positive COVID test at the time that they were sick. 70% of households, though, had confirmed cases. So I had a household where the participant didn't have COVID, but there was COVID in her house and people were very ill. 70% of my participants spoke throughout their interviews of consistently following precautions like masking and disinfecting items that came in their house or disinfecting their hands. Gloving was extremely popular as well. And that's just what I picked up on through the interviews and through talking about their memories of the year. 20% of participants, so 2 people I talked to, never took any precautions and never planned to. And 10%, one person took very inconsistent precautions where sometimes she put a mask on, maybe because she was supposed to in a store. Sometimes she should have had a mask on, for instance, if she was sick and she was seeing other people, but she didn't. She started by cleaning her groceries when they came home, and that became much too much to do in a household that had all the children home from school, so she stopped. Only 20%, meaning 2 people, were vaccinated by June 2021 when I started the project. And one of those people felt it was necessary to hide the fact that they had had COVID vaccines from their friends and family. So this is a small sample size statistically. It's not something we can depend on to be statistically significant in terms of the rest of the population. But from what I'm hearing from statisticians and people doing studies, including one of my colleagues at Imperial, Seth Flaxman, he's finding similar kinds of balances in his research, statistically speaking. So this is a representative sample, especially in the stricter Hasidic groups. And just some things to think about in terms of the Hasidic people I spoke to and their communities, and how their life may affect their ability to fight COVID as a community and conform to the guidance and other things like that. These are families that are extremely large. And there's a very, very high rate of poverty. So people live in small apartments without outdoor spaces and have many, many children. The community generally makes an effort to avoid any information or contact with the outside world. People do not have televisions. There is often no radios. Hang on. Sorry, we'll make it through. There's Yiddish language newspapers. So some people only get their news through them. And some of the rabbis for some of these groups also forbid smartphones, the internet, computers, things like that. However, they do engage with the non-Hasidic world on a regular basis. Many, many Hasidic people are business people, and they may have business relationships even around the world, as well as with non-Hasidic people in New York. They use public transport, so they're in the world, even though they're trying not to be too much of the world. They have lower than average secular education levels. In general in the community. That doesn't mean it's true for everyone. You can have people who've gotten doctorates in the Hasidic world, but for instance, the Satmar Girls High School will not be recognized as a high school diploma in the rest of the country. And so in general, there's just a lower level of secular knowledge. But there is a very high appreciation for learning and thinking, especially in religious learning and people who spend time with the texts. And that carries over, I find, to people who've spent time getting degrees or becoming a doctor and things like that. So depending on the person, there's varying levels of distrust of outsiders. Some people felt that much more strongly, and other people were much more open. So the first question I'm going to try and address was, why was the New York Hasidic community affected so strongly so early? And they really were. Every study that has come out has said this, and the people who I was talking to really talk about it like it's a trauma. So first of all, there was some very bad timing. Purim is a Jewish holiday that commemorates the book of Esther, and in 2020 it fell on the 9th and 10th of March. It is the most mingling of holidays in the Jewish world. People throw parties, they go to each other's houses and bring gifts of food to everyone else in the community. You're supposed to get drunk. It's very much the only holiday where you're mingling with the entire community as part of the day. You might, in other holidays, see them in synagogue or have your family over, your extended family over for a meal. But only on Purim are people partying in the streets together, in their homes together, giving each other money. So this already presented a really difficult situation where if somebody had it, it was going to spread. It's also a popular time for weddings, and people from all over the world come in to attend these weddings. There are 200 to 300 people who come, and everybody is together dancing. So that did not help either. One person who I talked to had gotten it because of an exposure at a wedding just before Purim. And before we sort of come down on everyone for having these weddings and still throwing a party on Purim, on March 9th and 10th, we really weren't sure that it was here. We didn't understand yet how long it took for symptoms to show. Even the New York City public schools didn't close until the 23rd of March. Excuse me. They didn't even announce it until the 15th of March, which was 5 days after Purim. So it's just a really, really bad situation that was already in place. So Blima, one of my participants, is in her mid-50s and she lives in Borough Park. And she said, before Purim, there was very little, like not anything we took seriously, just whispers in the air, and not anything that we thought was going to happen, like nothing we thought was real. So she's saying that they really didn't think COVID was there. They didn't think it was going to affect them. They had no idea they should be careful. Now, Moshe, who maybe had a little more of awareness, said, Purim, I was afraid a little, but I washed my hands and I taught my kids, he taught his kids how to stay safe. I didn't go around that much on Purim like I used to. Then I got COVID probably days after Purim. So when the Hasidic community is hitting a surge because of the gatherings on Purim and the weddings beforehand, it's also when the rest of New York City is hitting a surge. And the hospitals at this point are completely overwhelmed. And we don't know much about COVID yet at this point. They started having issues with not enough oxygen, not enough beds. For those of you who might not be aware, they were bringing in extra refrigeration trucks to parking lots because the morgues were overwhelmed. The hospitals were completely overextended and understaffed, and this was a problem that was compounded by lack of PPE, so that the doctors and the nurses themselves kept getting COVID and being unable to work. I just want to put out there that any of the rest that comes next is not meant as a criticism of the healthcare workers who worked incredibly hard during this pandemic and did the very, very best that they could. It's just a really tragic circumstance. And I hope that nobody takes it that way. So this is Chayla, who is a Satmar Hasidic woman. She lives in Kiryas Yoel, which is in upstate New York, but everybody in this community goes to hospitals in New York City because it's the closest proper, fully fledged care centers. And she told me this story that I heard multiple times. It's a son who's talking about his mother who's in the hospital. She was an elderly woman, and she called from the hospital to say, I'm hungry, I'm hungry. And then they said, and then she didn't respond anymore. And then they called that he could come say his goodbyes. So he gets a call from his mother that she's hungry and she hasn't been fed. And then eventually this elderly woman becomes unresponsive, and the hospital calls him to come say goodbye. He put a container of chicken soup in his pocket, okay? And he went to his mother, and when he went to say goodbye, he fed the container of chicken soup and he watched her come back to life. So this situation was obviously incredibly stressful, and we're going to think about that more in a little bit. This is Blima, who's from the Babov sect. We heard from her earlier. And she tells us her father died less than a week before Passover. Thank God we didn't have to delay the funeral, but that was because we dug his grave ourselves. So in Judaism, it's really important that we bury our dead as soon as possible. And to delay a funeral is possibly the worst thing that you could have happen. And it happened to many, many people during the pandemic. Otherwise, it would have been too late. We went to the cemetery and his sons and his grandchildren started digging with their hands. Only then, it was only when his children had dirt on their hands, did those people come over to help. So she's talking about cemetery workers who were taking a break. They were overwhelmed. There were so many graves they were digging. And she says, and we dug for someone else. We were there and we saw the car come up with the body and no one was there. They had no one. So we buried that person too. So many. You know, some people lost tact during this a little. I had one friend call me during Shiva, which is the Jewish mourning period where people sit and mourn for 7 days. And we talked and she shared her condolences. And then she said, okay, you're number X on my list and I have so many more people to call. All condolence calls. Everyone was sitting Shiva. So there was a huge amount of tragedy in the Hasidic world during this first surge in COVID. There was tragedy everywhere in New York, to be honest. But the statistics show that there were actually fewer deaths in the Hasidic world per the number of cases of the illness than in other communities. And I saw a paper, I heard a paper on these statistics before I started my research and asked why this statistician thought that might be the case. And he posited that perhaps it was because the Hasidic world is generally younger. And it's true that they do have a lot of children, but they've always had a lot of children. So I wasn't convinced that simply age was meaning that there were fewer deaths in the Hasidic world. But I think I started to find the answer when I did the research. So for those of you who don't know, there's a community-run emergency medical service in every significant ultra-Orthodox community in the world called Hatzalah. It's an ambulance service in New York. It's just like any other ambulance service. It responds to everyone, Jewish or not. They were the first responders at 9/11. And Hatzalah started doing everything they possibly could to keep COVID cases at home in the community and not bring them to hospitals. And this worked with the help of gemachs. Now, gemachs are lending organizations. You can get money from a gemach. You can get a wedding dress from a gemach. You can get something for your kitchen from a gemach. And they also have medical gemachs, which were lending out oxygen tanks and pulse oximeters, measuring the level of oxygen in people's blood and their heart rates. Around the clock, Hatzalah was delivering these to people with COVID. And that was really keeping numbers down from having to go to the hospitals. There was also the creation of a gemach called well tabs. And they were tablets like an iPad. And we're about to find out more. So Hayala, our Satmar friend, told me there was a man here that his father was in hospital. So this is a little bit of Yiddish grammar. His father was in the hospital. He called his kid on the cell phone that he's on the floor, and he's on the floor for a long time. Please come down and get him. They called into the hospital to let them know that his father is on the floor, and if he's not being picked up right now, they're taking him out. They ended up taking him out anyway. It was a couple of hours later, lifted from the floor, and then he went home. We heard a lot of such stories, and what happened was that we had well taps. So because we don't have technology, and a lot of us don't have anything, there was an organization that opened called Well Tabs, and they provided tablets. So the Hatzalah, if someone called Hatzalah and they needed to take the patient to the hospital, they got a tablet. So these tablets connected families with their loved ones in the hospital, and they stayed on 24/7. They automatically turned off for the Sabbath and turned back on after. And in fact, some hospitals started turning them off. And then Hatzalah stopped bringing patients to the hospitals that turned off the well tabs. So this gave people at home a chance to monitor how their loved ones were doing and possibly call the hospitals to get them care if they needed to. So through this, you can see that there were some very strong community responses to the pandemic. But I get asked a lot, what were the messages from leadership? What was really being told? What were people really doing? So when did schools close, and did they stay closed? And this all depends on the leader. It all depends on the group of Hasidim. So the Lubavitch and Stalin Hasidic groups were very proactive. They closed their schools 2 weeks before the New York City public schools, the state schools. They remained remote over the phone for people who don't have internet for the remainder of 2019 to 2020. And then starting in 2020 to 2021, they started mixed remote, mixed masked in person and bubbled. It was very much like the way a lot of public school systems, state school systems were doing it safely in the States. And now this year, they are continuing to have masked policies in their schools. Satmar closed the schools when the other schools closed. The boys immediately went to schooling over the phone. And then after Passover of 2020, they started holding classes in smaller groups in their teachers' homes in person. I am told that they were masked. The girls had no school until after Passover, and then the girls had school over the phone. And then in autumn 2020, they started school again masked, but gradually stopped enforcing the masking over time. And the other groups vary between those kinds of cases. So it's anything in there, but most groups had school over the phone. Did the rabbis tell people not to come to the synagogues? There's a lot of question about this. There's a lot of stuff in the press about this. And the thing is the vast majority of the rabbis told their people to stay home, but they're not in control of everyone's choices. So the Stolin Rebbe, the great rabbi for the Stolin group, forbade gathering entirely until very, very recently. Lubavitch also discouraged gathering, and if you were going to do it, they maintained masked gatherings and social distance gathering very, very strictly, often outside as well. The Satmar ruling was generally that if you were old or if you were high risk, you should not come to the synagogue. The problem is all of these communities, people live very close together. People are all Jewish in the same kind of street or block. And people feel very obligated to form groups of 10 or more men to pray because it says in Judaism that that is necessary, and that you must pray 3 times a day. These are commandments. And it's very hard for people to go against the way that they've been taught to think their entire lives about how to do this. So even though there is rabbinical rulings that say, there are rabbinical rulings that say that if it puts somebody's health at risk, it should not happen. Some people felt that it was the righteous thing to do, to form these groups on street corners or in somebody's living rooms, or just to make it happen. So ultimately, the leaders found a compromise and encouraged outside meetings for synagogue, for prayers. What is the message about vaccines from the leadership? This is a very good question. It varies by leader. The most encouraging is the Stoliner Rebbe, who has mandated all of the people who learn in his community get vaccines. Lubavitch also strongly encourages vaccines. It's very much less clear in other groups. I heard a lot of people saying, well, my rabbi said, if I had strong antibodies, I didn't need to get the vaccine. So you don't know if that's the message from the rabbi or it's what people want to hear. But it varies. I saw this poster, and I'm going to read it for people who can't necessarily see the picture. It was hanging in Borough Park on the main drag. And it says, the COVID shot hurts, the truth hurts more. Come hear the painful truth and what you can do about it. Will our schools, our synagogues and our schools be shut down again? Are we about to lose our freedom and autonomy? Should people be forced to vaccinate for COVID? Should kids be getting the shot? What does God want from us in this situation? And then it says an evening of tefillah, so an evening of prayer and education with a bunch of rabbis and a bunch of doctors. So it's very, very unclear whether this is pro or anti-vax. But I did some digging and I'm fairly sure it is supportive of people getting vaccinations, but they're trying not to deter people by making this obvious. So why are Hasidic communities so hesitant around the COVID vaccination? Is it just because they're anti-vax in general? Not according to my research. So of the people who I talked to, 100% of them give their children all regular childhood vaccines. And 70% of them were very clear that they have no reservations about vaccinating themselves or their children. They get the flu shots. They don't have an issue with vaccines. Of the people who have issues, they did it because the school required it and it wasn't worth it to them to fight the school. So the two people who got vaccines were Moshe, who we've met, and Mushki, who is the Lubavitch participant. And Moshe kept his vaccination a secret from his family. His wife hadn't wanted to vaccinate the children, but he made that happen, and he's not letting anyone know he's got the COVID jabs. Mushki, she agreed to be vaccinated because she's high risk, and she doesn't believe that she doesn't believe that she's had COVID, but she also doesn't believe it's necessarily for healthy younger adults to have the vaccines. So she says, my husband has antibodies and he was never sick. I don't have antibodies. My question is, do I make him vax or do we not vax? I vaxxed. So that's my real question with my husband. If he has antibodies, is it worth it to vax? Because the antibodies seem to push away the infection more than the vaccine. So I don't know. As far as I know, I haven't had COVID. I got vaxxed in March. I got vaxxed because I'm overweight and because I'm a risk factor. And I always say, I get the flu shot every single year. I'd do anything not to get sick. So that's Mushki. I wouldn't say it's overwhelmingly enthusiastic for the vaccine, but she has some really interesting questions. Hyla, our Satmar friend in Kiryas Yol, says, I personally don't see a reason for me to take the vaccine if I had a full COVID, so she had COVID and she had it pretty bad, and my antibodies are high. I checked my antibodies in pregnancy. My doctor said my antibodies are really good. My kids are all vaccinated. I mean, I'm not talking COVID, everything. Yes, whatever is necessary, even the chicken pox, which is not mandatory. I believe in vaccines, but I don't believe in overdosing. I believe me taking the COVID vaccine is like overdosing. I just don't believe that there's anything that the artificial could give me that the original gave. And this is long. It's a conversation between Belima, the Baba of Hasidic woman, and her adult daughter about the vaccine. So she says, I'll be honest, I'm skeptical. I'm looking at all the media. I'm reading in all directions, all sorts of media documents. I just read. There's something I just read by a medical doctor that made me especially skeptical. Really, there's just so many things that could go wrong. The adult daughter says a lot could go wrong. Belima says the fact is we don't know the long-term effects. And her daughter says, why expose yourself to that risk? It's just not worth it yet. Belima says there's not enough research. They haven't studied it enough. What I find really unfair is that they will use it to limit what I can do, like travel restrictions. I should be able to prove I have antibodies. You know, maybe if I had a pre-existing condition or I was high risk, or if I hadn't already had it, then okay, it would be a choice between the two evils. But it should be made as more of a choice. They shouldn't have to have it. The daughter says, if people have antibodies, why do they need the vax? We also just find it so contradictory. They are saying we should do this, get the vaccine for our health, but they're offering people free donuts for it. That was the thing in America, for those of us who don't know. Like, that's just so contradictory. Belima says it really is a turnoff for us. You know, we don't just take medicine just because. Okay, I'm glad we have antibiotics and I take them if I need them. And when the polio vaccine was created and Dr. Salk did all his tests and we took it, and thank God, because that ended something terrible. We're grateful for modern medicine, but this needs to be like that. They need to make sure it's safe. So a lot of these questions are revolving around things like whether or not it's necessary if you have antibodies, how safe is it, things like that. So I'm going to stop talking now because I still have a voice, and open up the floor to questions. But first, I'm going to give a quick plug for my course, which is the Ultra-Orthodox Jews of Israel. So this is on my research in my doctorate instead of this. So we'll start by thinking anthropologically about Ultra-Orthodox Jews, and then we'll do a little history and understanding how their identity sort of comes to be. And then we'll look at women's roles and listen to some of the voices of the women who I did research with in Israel. And then we'll end by talking about some contemporary issues.
Thank you so much, Heather. I hope you can hear me again. Can you? Yep. That was a really brilliant presentation and so fascinating to hear the different opinions of the people that you interviewed. I can see that we have a raised hand and we've got an interview. So we've got a question in the chat. I think I'll start with the chat question if that's all right, because that's been waiting there for a few minutes. So we've been asked, did you interview the cemetery to determine why they did not supply burial services?
I did not. When I do a big project, I hope to do things like that, interview them, talk to people who work in the community but are not maybe members of the community. But it just wasn't feasible in a short summer project like this. This was almost like a pilot project.
Imagine it was there was just an overwhelming number of things for them to work on as well at that time. You say they were so busy, everyone was so busy, and it was such difficult circumstances.
Yeah, the amount of deaths within a single 2-week period at that point was bad. The newspaper article on that slide was the New York Times article where they opened up part of Potter's Field, which is historically where we've buried people who haven't been claimed in New York. And they they opened it up just to put bodies there for now. And then to find them later, they kept records because they had nowhere else to put bodies. So I'm pretty sure the cemetery simply could not keep up.
Yeah. I think, Carol, if you'd like to unmute and ask your question.
Yeah, I'm from London. I'm not from the Ultra-Orthodox community, but I was employed by the government to work with the Haredi community in the equivalent of Williamsburg in London in the 2021 census. I think you had a census in 2020 in New York, and I think that in London they relied quite a bit on they used it as a guidance what had happened, what went on in New York. Anyway, get to my question. I was out and about in the main shopping areas in the equivalent of Williamsburg, it's Stamford Hill, and was very interested to see that when I went into a Jewish shop, it's a very well-known baker's shop. They had notices up there saying, you know, wear a mask and so on, but nobody except me and some of the servers actually had masks on. All of the, you know, Haredim there didn't have masks on, but when they went into a non-Haredi shop, then they would put a mask on. And there was a very high incidence in the UK of COVID amongst the Haredim, is not surprising. I've forgotten the exact figures. I think 60% of them had the virus at some point. So I don't know what your view is on all of that.
Well, so I do live in the UK, and I am currently conducting research through Oxford with people who live in Stamford Hill and elsewhere. I have two thoughts. One is that I had the same experience walking into my village shop where it says, please wear a mask and everything. And I'm usually the only person wearing a mask in there, and none of the employees are wearing it either. So I think this isn't special to the Jewish community by any stretch of the imagination. But I do know that a lot of Jews have received abuse, often anti-Semitic abuse, for not wearing a mask. It almost seems to be an excuse for some people to attack them. Hayala was wearing a mask in a store, was with a friend who was vaccinated already, and she was not wearing a mask, and they were both attacked because she was not wearing a mask. And this was after President Biden said that if you were vaccinated, you do not have to wear a mask. So I think probably people are putting on masks in other places where it's not a Jewish store because they're trying to protect themselves.
Well, what about in the Jewish shop? Because in the Jewish shop, when they went into the Jewish shop, despite the notices, they didn't wear their masks.
Well, neither do my non-Jewish neighbors in the village shop, so I can't speak for them, I'm afraid.
That seems fair. I've got a lot of questions on the chat here. There's a lot of interest, as I'm going to pick some at random. I'm aware that you are struggling with your voice, so do let us flag us if you are in pain. None of us want to see you in pain. Someone asked, what made you research the Hasidic communities of New York but not of England?
I'm getting to England now.
Okay.
So the hope is to do a massive project that would compare Israel, England, and the US, and would take into account different healthcare systems in those countries and different circumstances and relationships with the states. I have to prove to my funders that I can do research in each of these locations. So I got some small research done in New York, and I hope to do more in the future. And now I am doing research in England. I've got participants in London, in Manchester. So we will see where it goes.
A sort of related question, which maybe you'll be able to tell us in a year's time if your research goes well, but are you aware of how the ultra-Orthodox community in Israel reacted in comparison to what you saw in New York?
Actually, I feel like I should probably not necessarily answer this question, because I know Ben Kashtan is here. I don't know if he's willing to help me out on this. He's been doing research with the ultra-Orthodox communities in Israel for the past couple of years. So he could probably tell us a little bit more. But I hope to be able to do some research in Israel on public health attitudes in general and vaccination attitudes at some point.
Brilliant. A question, because I know that this was reported in the press and I remember reading about it too. Do you have any information of the unrest or riots in the streets reported in the press during the COVID peak?
So we talked a lot about several different kinds of riots. So I'm just wondering if this person is asking me about Black Lives Matter or about the pro-Trump anti-masking riots, which were in the same streets. But the people who I talked to had strong feelings about the fact that Black Lives Matter protesters were not criticized for congregating, but they were criticized for going to synagogue or having a family meal. So that really touched a nerve in the community. And they weren't necessarily against the messages of Black Lives Matter, but they didn't want it happening in their streets. In terms of the pro-Trump anti-masking rallies, nobody I talked to went so far as to participate in any of those, but they supported the mindset. Some of the people I talked to supported the mindset of them.
Okay.
And there was a lot of anger in the community, especially in terms of the time that somebody in the Hasidic community publicly broke the chain on a fence into a public park and opened the public park for the children to use. There was a strong feeling that he did the right thing. He just might have done it the wrong way, because all of these kids were trapped at home in houses without outdoor space to play in.
Yeah, it's pretty unimaginable, really. We've got a few more if you're happy to keep going. Keep on with the magic tea.
I've still got tea.
Did you get any sense that they saw COVID restrictions as a threat to their way of life, i.e. a mistrust of authority and their policies?
So there's generally distrust of the policies in general. And I have to preface my answer with explaining that also right before COVID, there were two major anti-Semitic incidents that affected these communities. Almost all of the Satmar people I spoke to either were related to or were friends with someone who was affected by the Jersey City shooting. I know people who lost family members and are now raising, or know people who are raising children who were semi-orphaned because of this. There was also the stabbing on Hanukkah in Muncie, and the several of the people who I did interviews with lived less than a block away from that event. And there was a strong feeling that nothing was really being done to protect them, that the state didn't really care about these things, or any of the other anti-Semitic attacks that around that time. And then they felt that also the state was excessively interfering in Jewish business, meaning they raided a school in Long Island, an Orthodox school. And there was nobody there, but they tore the school apart, from what I'm told, the authorities, the New York State authorities, trying to find where the children were hiding, and there were no children there. So these things started to wear on them. There's a sense that Jewish businesses were being targeted more than other businesses for breaking rules and stuff like that. So this is very much in New York. I haven't heard this in other places. And so something sort of flipped for them around the time of the Black Lives Matter protests, when they saw this happening. And then they said, but you closed my store down. And they just started not paying attention basically to these mandates and finding ways around them. And some people I talked to were very proud of how their community found a way around it. So I would say there was a bad relationship there to begin with, and it just deteriorated. And that didn't help anything.
Mm-hmm. Yeah. The next question, which is linked to that in some ways and also answers, is the same question that I was going to ask you, was how different in terms of the spectrum of views about vaccination expressed around COVID is the profile of ultra-Orthodox Jews to that, say, of the population of New York as a whole? So I was going to say, you said that by June 2021, 20% of the people you spoke with were vaccinated. And I was going to ask, how does that compare to the general population? If the two are related.
I can guarantee that the general state population percentage of vaccination is much higher than that. I don't know what it is, but New York's one of the highest, has one of the highest rates of vaccination uptake in the country. I was living in Connecticut while I conducted this research because that's where I'm from. Connecticut has the highest, and we have over 80% vaccine uptake. So generally people who live in the area, it tends to be very blue, if you know what I mean. It's a very democratic voting area. It's a very left area in terms of state politics. And unfortunately, a lot of this seems connected to politics. And so I think in general, people are getting the vaccine more often than not, because unfortunately it does connect to your political stance. I don't think a health decision should, but it does in this circumstance in America, at least. It's such a polarized country right now. Now, in the county where Kiryas Yoel is, it's not quite so clear cut. And I think there is a much lower vaccine uptake in that county. And that's not influenced greatly by the village of Kiryas Yoel. But I don't think that people are connecting local politics to it. And I don't think that holds much meaning. I think it's just a coincidence of rural life more than it is a connection, because Kiryas Yoel is not necessarily at peace or at amity with its neighbors. They don't necessarily get along. There's massive conflicts there.
Okay. I think the next question is, and maybe I'll have two more questions. The next question goes on from that, I think, and it is, or perhaps you already answered it partly in what you just said, but did you notice links between the positions of your participants and those of the Republican Party? So did they cite Trump and issues around denial?
Generally, people were supportive of Trump, but in a circumspect way. There's an expression in Yiddish that says, basically, I wouldn't want to make a match with him. He wouldn't be a good shidduch for my daughter. But I like him as president, is what one person said. Some people said, okay, I liked Trump, but I wasn't overly enthusiastic about him or anybody else. And so I think there are sort of people who are more loudly Trump supporters in pockets of the Hasidic community, but more in general, it's a softer sort of like, okay, I think he's a little better for us than the other alternative. connecting Trump to vaccine uptake, though, is not necessarily a corollary, because they connected him and what he said and the fact that people should listen to Trump more to alternative treatments for COVID. So some people went and pulled out their bottles of ivermectin to show me, or hydroxychloroquine, which were these treatments touted by a doctor actually very close geographically to these communities, who's treated these communities, and who Trump sort of held up as this hero who could offer these treatments. And other studies have shown that these treatments do not work. In terms of the vaccine, nobody said, well, you know, Trump didn't told me not to, or anything. Sure, people are acting somewhat supportive in a lukewarm way of Trump, I would say. But I think the vaccine uptake has more to do in general with the vast amounts of information that people can now access. Despite not being allowed to, most people had smartphones, most people are searching the internet. And how do you make a decision about what piece of information on the internet that you decide to listen to? And especially when you have lower secular education than average.
Yeah, absolutely. I think, given that you've been so brave, we'll finish with one final question before we let you go and relax. And I think it's a very interesting one. But I'm not sure that you'll be able to give us a cut and dry response to this. But why are ultra-Orthodox groups so fractured, so different in terms of their stance, their take on COVID? Is there a core belief or a traditional influence at work here, would you say?
So I got to give you a quick history of the Hasidic movement. So bear with me.
I didn't pick an easy question for you to end on there, did I?
About 300 years ago, there was someone named the Baal Shem Tov, the master of the good name in Eastern Europe, who was the founder of modern day Hasidic Judaism. And he was known to be incredibly enlightened, and he taught a student named the Maggid of Mezerich. And then the Maggid of Mezerich taught a number of students, and each of these students went home to their cities in Eastern Europe, and they taught their students. And some of their students went off and formed their own Hasidic groups. And so you get farther and farther away, and each one gets a slightly different character. In the Hasidic world, it's very much, you do what your rabbi says, your great Rebbe, and you don't ask a bunch of different rabbis for opinions. You might do that in the Litvish, the Yeshivish world, but you just listen to your one rabbi who leads your group in the Hasidic world. And people make jokes. A wife asks a husband, what do you want for breakfast? And he says, hang on, let me call the Rebbe. So it really does start to control every decision you make in your life. And a lot of people find this very relaxing. And some people who become Hasidic, who didn't grow up Hasidic, really enjoy it. But each rabbi is going to have his own opinion, and they don't all get together and chat about it. Some of them are friendlier with each other than others, but it's like completely different churches. If you're a Christian person, there isn't a way for the Pentecostals to find out what the Catholics are doing and make it all work together. So they may look superficially very similar, but there can be really big differences. For instance, the Satmar Rebbe who leads Kiryas Yol, women don't drive in Kiryas Yol. But all the other Hasidic groups in Muncie, which isn't very far away, women of course drive, and men do too. So everybody makes their own decisions and decides what's best for their people in different ways. And unfortunately, it can lead to conflicts within these groups and between these groups, but hopefully it doesn't happen too much like that. But you're gonna get rabbis who everybody's doing their own thing, unfortunately.
And that's true around the world.
Yeah.
Oh, thank you so much, Heather. That was such a brilliant presentation, and you sparked so much curiosity in all the viewers, so many questions, and I'm sorry I didn't get a chance to ask them all. You'll just have to sign up to Heather's course, which starts on the Wednesday, the 17th of November. I hope you'll be able to join us. Places are limited, so I would encourage you to sign up sooner rather than later. I'll be sending out a survey shortly, and we'd really appreciate your feedback to help us shape the future of our events. So I'd be really grateful if you take a minute or two to complete that. But all that's left is to say thank you very much for joining us, and thank you, Heather, for that brilliant talk. Okay, good night.
Thanks for having me. Thank you,
Have a
Shirley.
rest. Thank you all.